Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe for updates. Psoriasis, and you're looking at its nail changes. So the nail changes in psoriasis is present in about 40% of the cases, and at any point of time. The nail psoriasis is associated with more extensive psoriasis. So it's associated with the extensive psoriasis. And there is the longer disease duration. There is long disease duration. Then comes the family history of psoriasis, family history, and this is of the psoriasis. Then comes the presence of the psoriatic arthritis. So there is also presence of the psoriatic arthritis. Then there is a subungual drop sign or the salmon patch. Subungual oil drop sign. The subungual oil drop sign. Then comes the presence of the salmon patch. There is something known as a salmon patch, and this is highly specific. It is highly specific. So it is the salmon patch. It is highly specific pathognomic sign. So highly specific pathognomic sign. And this is seen in nail psoriasis. Nail psoriasis. Next is the subungual oil drop sign. It is a yellow-red discolored. So there is yellow-red. So it is a yellow-red discoloration. Yellow-red discoloration in the nail. So it's a yellow-red discoloration in the nail bed, and it resembles a drop of oil. Next, what we look at is the nail pitting. So nail pitting is the most frequent sign. It is a very frequent sign. And other thing to notice, there is the individual pits and uniformly sized. There is presence of individual pits as well as there is uniform size. So there's individual pits, there's uniform size, there's deep and irregular in nature. It is deep and irregular in nature, and the nail pits are known as the thimble pits. So it is thimble, Thimple, thimble pits, and are due to the involvement of the proximal nail matrix. It involves a proximal nail matrix. Next, we look at the nail bed disease. So there is a presence of the nail bed disease. So this nail bed disease, it also causes the subungual hyperkeratosis. The subungual hyperkeratosis. Next is there may be splinter hemorrhages. The splinter hemorrhages. Subungual hyperkeratosis, the splinter hemorrhages, as well as there is distal onycholysis. Then comes the leukonychia. The leukonychia, it may be also present. Then comes the trachonychia. The trachonychia is also known as a 20-nail dystrophy. There is a 20-nail dystrophy. So it may be present in severe cases. It is present in the severe cases. Now, let's focus on the features of nail psoriasis. So features in short, what does it include? So there is a mnemonic known as polish. So let's expand this polish. So here, what is P? P here stands for the pitting. Then comes O. O stands for the oil drop. So there's oil drop sign as well as the oncholysis. Next we look at L. L stands for the leukonychia. Then comes I. I means irregular pitting pattern. Then sphincter, S is for sphincter hemorrhage. Sphincter hemorrhage. Then comes H. H is for the hyperkeratosis. Hyperkeratosis, it means it is subungual. To learn and grow daily like this, please do subscribe.